Hi, good day everyone. It's your girl Sky. And for today, I would like to discuss to you a disorder that made my mind blown and truly a peculiar one. We've seen this from some movies like The Act, Sharp Objects, and many more. Now, do you have an idea what disorder is this? And it is the factitious disorder. It is a condition where a patient falsifies their physical or mental health symptoms on purpose, simply for their personal gain. Symptoms can be manufactured or self-induced. In addition, there must be no other mental condition such as delusional disorder or other psychotic disorder causing this. With this disorder, it's either something we impart to another person or something we impose on ourselves. With that, factitious disorder has two types. The first one is factitious disorder imposed on self. Patients who have this disease deliberately induce, fake, or exaggerate physical or mental health issues for selfish gain. These patients are solely driven by internal motivations, such as a need for attention, a way to deal with stress, or a desire to confound medical professionals. According to the Diagnostic and Statistical Manual of Mental Disorders 5th edition or the DSM-5, these are its diagnostic criteria. Letter A. Falsification of physical or psychological signs or symptoms or induction of injury or disease associated with identified deception. This falsifying psychological or physical symptoms creating an illness or injury which is connected to a known disease. The next one is letter B. The individual presents himself or herself to others as ill, impaired, or injured. Or simply in the eyes of others, the person appears to be unwell, damaged, and disabled. The next one is letter C. The deceptive behavior is evident even in the absence of obvious external rewards. Even when there are no clear external rewards, the dishonest behavior is still present. And lastly, letter D. The behavior is not better explained by another mental disorder, such as delusional disorder or another psychotic disorder. With this, we also need to specify single episode and recurrent episodes, or two or more events of falsification of illness and induction of injury. The next type of factitious disorder is factitious disorder by proxy or imposed to another. When someone suffers from this mental disease, they may act as if their child or dependency has a medical issue that requires immediate attention. On the other hand, the child or dependency is not that totally ill. People suffering from a factitious disorder imposed on another lie about another person's condition. It means that a person with this disease creates a medical condition for someone else. According to the Diagnostic and Statistical Manual of Mental Disorders 5th edition or the DSM-5, the diagnostic criteria of both disorders are the same. Yet, in this type of disorder, the perpetrator, not the victim, receives the diagnosis. People who have factitious disorders imposed on themselves or those with factitious disorders imposed on others have run the risk of suffering from severe psychological discomfort or functional impairment by hurting both themselves and other people. And now, we have here the treatment and management. According to studies, psychotherapy is the only effective treatment for factitious disorder that is now accessible. Based on the data that is currently available, medication does not significantly reduce factitious disorder symptoms. Patients with factitious disorder, however, frequently have associated with psychiatric disorders including depression. It is crucial to properly treat the comorbid symptoms in these people because doing so may subtly reduce factitious behavior. The patient's willingness to begin appropriate treatment is one of the main difficulties. A strategy must be prepared in advance of the confrontation that minimizes embarrassment and accusations. Many professionals believe that the patient must be confronted before receiving any treatment. An interdisciplinary approach is advised by certain experts. In order for us to have the final and correct diagnosis, we must have a method of analysis of a patient's history and physical examination. For the last part, we have here the differential diagnosis. The first one is malingering. The deliberate reporting of symptoms for personal gain separates malingering from factitious disorder. Contrarily, a factitious disorder diagnosis demands that the illness falsification cannot be entirely explained by external rewards. Malingering and factitious, the conditions are not the same though. Depending on the conditions and behaviors of others, there may be numerous motives at play. Next is somatic symptoms and related disorders. There may be excessive attention and treatment seeking for alleged medical concerns in somatic symptom disorder and the care-seeking kind of sickness anxiety disorder, but there is no proof that the person is lying or acting dishonestly. We have here the other differential diagnosis: deception to avoid legal liability, functional neurological symptom disorder or conversion disorder, borderline personality disorder, and medical condition of mental disorder not associated with intentional symptom falsification. I hope that you've learned something today. Thank you very much for watching. Again, it's your girl, Sky. Till next time, bye!